So definitely, I think that the younger the generation, the more open they are. I think that definitely is like a huge change, even just still incoming. And in my hospital, being a very big hospital, I'm still paper charting. So that's horrible because like I was born to be a doctor. My handwriting is just horrible as well. So it's like it's a system made for errors, and I feel like digitalization has to not only be coming because it makes our life easier, because it makes our life more correctly. And I feel like there's still like in Germany, especially, I don't know about the UK, but in Germany, it's like privacy is still a big thing. Like people are scared of having their privacy ripping apart from their hand. Like they're scared that someone's going to read up your chart. But I mean, we need to read up the chart because like when I have someone coming in who's never been in my hospital ever before, I don't know him. I don't know the person. So there's nothing in my system I can look up on. There's nothing I can read about this person. And best case scenario, he's awake or she's awake and can tell me like, oh yeah, I have like hypertension or like I had like 3 stents already taken. But worst case scenario, someone comes in unconscious and I barely know the name. And it's a huge problem because like digitalization can be so easily made. Like because we all have insurance, why not share it and make it possible for every hospital to have access to the information, just the most important ones. And Germany is working on that. It's a huge topic coming up with the new election as well. And the electronic form of insurance card is also coming up. And we're facing lots of changes, but the changes has to be done. And I feel like my younger colleagues are also all on my side. They're always like, yeah, we need to get this happen. We're going to make our life easier. But I do see some like hesitance from the older generation still, like what I see personally in my hospital.
Thanks. And I think, again, what you touch on is very important. You know, I read a bit about generative AI as part of my usual reading and meandering. And I came across a very interesting phrase that one of the authors has used, and it's been used quite a lot on different forums. And it says, you know, when you think of AI, I want my AI to do the dirty dishes and wash my laundry so that I can paint a picture and write a poem. But what currently the AI is doing is writing the poem and painting a picture whilst I'm doing the dirty laundry. And I think that's where there needs to be a change in the mindset. So when I apply that to my workflow, and I'm hoping you'll agree that finding out information about my patient is the dirty laundry and doing the dishes, which is important to do so that you can then paint a picture, which is what is the diagnosis, you know, what is the workup I need to do. And it's always interesting for me to see, especially from trainee doctors and young doctors like yourself, to understand, is that the part that we can trust the AI to do well for us so that we can focus ourselves on providing high quality care and painting that picture, if you like.
Mm-hmm. So for me, I think very important, I think I touched on this topic before when we talked, is like privacy and like patient confidentially. So when I have the AI part, I want to make sure I'm not like taking information and putting it out in the world. I want to have the information safe, and I want to make sure the patients feel safe with my scope. Because I see like as a healthcare worker, your computer is your best friend. That's all you do with. Like I use my computer, my phone, everything the whole time. So when you see a doctor, it's not only the person, it's always a computer. And like for us in my hand, like in our rooms, we always have computer. I have my iPad, I have my phone, and I'm going to use that. So that's what like using it all together. And I need to reassure the patient that I'm not like spreading the information on like WhatsApp or something. So when I look something up, I research something on different platforms, I want to make sure that I get the correct information and I'm not getting information just because I've been Googling it so much, because you can definitely like change your algorithm. Like if I Google 4 times antibiotics, Piperacillin-Tazobactam for this disease, I'm definitely going to find exactly what I'm looking for, but I can like change it a little bit, just like writing a different word. And for me, very important is to have just very focused and correct medicine. And like on Google or any big platform, you're going to find everything, not just medicine. And I, as a doctor, I need something where I'm sure I will put something in and I'm going to get just medicine. Not like an opinion from some random person 4 years ago when he thought this antibiotic made him bleed or some reaction. I just need facts, and we're working with facts, and that's what I really enjoy, like having on my hand. And I feel like this is actually like feeding myself, like feeding my knowledge, and not like flogging with like different knowledge I don't need.
Yeah, and again, that's an important topic of can you trust your AI model to deliver the high quality of information that you're craving at that point of time? Because you're not just using it to learn, you're also using it to do point of care, to treat your patient.